Good afternoon, everyone. Thank you for joining us today. You're here with the Parent Collective and the lovely Dr. Robin and Dr. Sarah from Village Pediatrics. So today we're going to be talking about milestones. So to be specific, first cold, first fever, first vomit. I remember those so well, and actually the panic that rises inside you as a first-time parent,
Absolutely.
how that feels. Yeah. So one of the things that I love was that you ladies have given us a shopping list. Go. Tell us what we need. Tell us what we need.
Well, I'm Dr. Sarah Siegel, one of the pediatricians here at Village Pediatrics.
I'm Dr. Robin Abramowitz, same. One of the pediatricians here.
So a lot of these items you'll get in your baby shower or other gifts, but the first thing you want to think about for your first cold is the nasal saline drops and your nasal suction bulb. And maybe you want to talk, I know there's some popular brands out there.
There's also, only found out by me during my third child's first cold, there's now the Nose Frida. I don't want to talk about brands too much, but there's some other brands that make it, and it's basically a device that you kind of put the suction part in the child's nose and you suck. There's a valve, so you're not getting your baby's snot in your mouth. Make sure the valve is in place, and it just gives you a little bit more control. And it's a lot of moms will already have known about this from like Sarah said, from their baby showers and such. But I think when you think about what to have in the house, you want to have the stuff waiting for you, not you running out to get it when it's 9 o'clock at night and the baby's miserable. So I kind of tell parents to have, infant Tylenol, infant Motrin, which we'll talk about, that's for greater than 6 months, Pedialyte, these nasal saline drops, suction, bulb suction, Nose Frida, things like this, so you're not sending the husband out in the middle of a snowstorm because now the cold started, and you just want to have these things on hand.
Or you're a mum on your own and you've got a baby with a fever.
Correct.
And you've got to go to CVS,
Even worse,
and that's which is horrible.
Of course.
Yeah, and the
course.
baby's crying and you're crying.
Right. And by the way, tears during your baby's first cold, first vomit is very normal.
Yeah.
Nobody wants to see their child sick at any point, but the first time around is particularly heartbreaking.
Yeah.
But they're going to be fine. Everyone's going to get through it.
Well, let's talk about nasal congestion for a second, because
Sure.
I think that is a challenging symptom. And as great as the saline and the suction, and specifically the suction where you can use, some of the power from your mouth to get that suction rather than just the bulb, are helpful, there's always going to be that sound of nasal congestion that you can't get out. You feel like, where is it? Is it high up in the nose? Is it in the sinuses? A lot of times that's just swollen nasal tissue, and all the suctioning in the world is not going to get that mucus out.
And could actually make it worse.
Right. If you want to comment on
Too much suctioning, too much putting the bulb syringe up there, you're hitting the walls of the nose and they swell even more, which can just make congestion worse. So I usually tell parents, if you don't see something, don't go in after it. You can use the saline drops as much as you'd like. That's totally fine. But don't go in for something blind, because then you're just going to hit the walls and potentially make the congestion worse.
Right. And if it's not bothering the baby, leave it.
I'm a picker, so I'm terrible.
You see that little piece coming out? Yeah.
Okay, so tell us a little bit about some supportive care that you can give to the babies. We've said the nasal saline, maybe steam?
Right. So depending on the age, when we're talking about really tiny babies, you want to be careful with too much temperature. It just can be uncomfortable for them. But as your babies get a little bit older and then you move on to toddlers and such, steam showers, where I tell parents, put the hot water on in your smallest bathroom, close the door, let the bathroom steam up, and then obviously shut off the really hot water and give your baby like a nice bath in there before bedtime. Kind of milk the nose with your hands a little bit just to clear things up, get them all nice and relaxed before you put them to bed. I think it makes you feel like you're doing something to make them more comfortable, and hopefully it does make them more comfortable and you get a better night's sleep. So I'm a big fan of the steam shower. I also talk a lot about cool mist humidifiers, particularly in the winter when we have a lot of dry heat pumping through our Connecticut homes or wherever you may live. Especially if you're congested, you're going to breathe more with your mouth potentially, and just dry air is going to be more uncomfortable, or just making everything that's in your nose dry up, which then you can't get out.
Yeah.
And then the baby's really miserable. You want everything up there to stay kind of moist. And runny.
Yeah. And cool mist, because the warm mist humidifiers can be a burn risk for kids if they get their hands on it. So the cool mist ones.
Oh, interesting.
Yes.
I didn't know there was a difference. So a cool
Yes.
mist rather than the warm mist.
Correct.
Even though the warm mist might seem like a little more soothing
Right.
and do a little bit of a better job moisturizing the nasal passages, it's the device itself can get hot, the water inside can get hot, and that's a burn risk as the child is maybe toddling around the room. So cool mist only.
Good advice there, ladies. I love it. So tell us about pace feeds. I've never heard of this before.
So when you have, especially with a really young one who's congested and they're trying to coordinate their suck and their swallow, parents can often notice that the baby gets really frustrated and they're kind of not wanting to feed, and sometimes you just need to pace for them. So they may not sit and take their feed in the normal, suck for 15 minutes, burp, and maybe continue on to finish the bottle or the breast. So sometimes you have to kind of pull them off a little more frequently, give them a second to kind of get
Catch
some
their breath.
Yeah, exactly. And just, so everybody doesn't get more frustrated, because every mother hates when their child isn't finishing a feed because you're just so worried, when they don't feed well. And then the baby's frustrated because it's just hard and they're trying to, catch their breath and get the food at the same time.
Oh, pace feeds, that makes sense now. Okay. Some of the things that we need to worry about. Tell us, as a parent, what should we be looking for?
Well, first let's talk about fever and how you check and what number is a fever. So in children less than 1 year of age, particularly in the newborn period, you're always checking a rectal temperature. You should always be checking a rectal temp. Yep, exactly.
That, of course you are. That makes sense. You can't put it in their mouth.
Well, but there's a lot of, there's other great
Right.
options.
There's temporal, there's ear. But
Right.
for that age group, to get a more accurate reading, we recommend a rectal temp.
Exactly. And the number that is considered a true fever is 100.4 and up. So while I think as moms, we know when our kids have 99, maybe they're brewing something.
Right.
But as doctors, we don't consider that a real fever. So would I give a little extra TLC to my kid when they have a 99? Am I suspecting that they're getting sick?
Totally.
Yes. But fever is truly above 100.4.
And I think we should make a point of saying, we're talking about babies first. So your first fever, we really hope is not going to happen in the first 8 weeks of the baby's life. And if it does, that is not something that we say, okay, just give Tylenol and give us a call in the morning and we'll see you. In that really young age group, it's a medical emergency and you call, us regardless of the time if it's greater than 100.4. It's before any vaccinations. They're just a more vulnerable patient population. So we definitely want to clarify that when we start talking about giving Tylenol and some supportive stuff, it does not apply to the less than 8-week-olds.
So less than 8 weeks, call you immediately.
Correct.
Absolutely.
Okay.
Yep.
Okay, that's great. So I love the fact that you've given us a little motto here, Robin. So keep the nose as clear as possible is the motto. I love it. Okay.
That's going to make everybody
Right.
happier. You're going to feed better. They're going to sleep better. Then mom doesn't feel like the baby's as miserable. So keeping that nose as clear as you can. Just a little anecdote. My middle one hated having a stuffy nose. So if there was anything in there, he wouldn't eat. So before I ever came to work, there was always nasal saline. We did it like prophylactically. Nasal saline and then a boogerectomy if necessary.
Yeah, I'll like that term. I've never heard that. I like that.
This was literally a term in my house. I would say, okay, boogerectomy before I head off to work so that he wouldn't, give the sitter a really rough day.
Yeah. Now, the littlest babies are actually what we call obligate nose breathers.
Right.
So they really can't, and this we're talking about the infants, the newborns, they really can't coordinate to breathe through their mouth other than big hollers and crying. So when their nose is stuffy, it really interferes with them more.
Right.
Interesting. And I know we were talking about, we very, very briefly talked on fevers.
Right.
Tell us about bathing children. Should you bathe them when they've got a fever? I always worry about that.
I think first for comfort reasons, you don't want, when you have a fever, although your temperature is elevated, you often feel cold.
Shivering,
right?
Yes, absolutely.
But sometimes, especially when fevers are particularly high and parents are, it's not coming down fast enough and the child's uncomfortable, a warm, not hot bath is, because once you come out of the water, that helps your body cool a little bit, but you want to cool them not too quickly. So I always say like a lukewarm or a tepid bath is what I recommend. Baths, even when the kid is fighting to go in, still often tends to calm most children down, except for the really water haters.
Yeah.
You were asking about concerning symptoms. We talked a little bit about fever.
Yep.
I think the other one, and we talked about fever under 8 weeks of age.
Yeah.
The other one would be difficulty breathing. More than just the nose is stuffy and they're fussy, but if you actually notice that your child is heavy breathing, flaring their nostrils, seeming like they're having to work to breathe, that's a concerning symptom, and you'd want to reach out to us right
No
now.
matter what age.
No matter what age.
Not being able to
Absolutely.
feed. But I do also want to clarify, just to on your point, when a child's temperature is elevated, they will breathe faster
Right.
normally. So there's a level, and you get to know your kid and what seems like out of the norm for having a fever. So while they may breathe a little faster, it just shouldn't seem so labored. It just may be a fast rate, but not using all those extra muscles.
Exactly.
And that's what we worry about.
Excellent. Okay, and going back to your point, Sarah, Dr. Sarah, what if they look? Because I remember with my daughter, she was very lethargic. That was what scared me.
Yeah.
I was like, oh, she hasn't left the sofa for, she's just laying there. Now, obviously, with the newborn, they're not going to be moving around
Right,
anyway,
right.
because we're talking about firsts. Just tell us a little bit about if they're sleepy or lethargic, because they're not moving around anyway. So, what should we be looking for?
Well, to medical personnel, lethargic means something, it really means something different. But I think what we're talking about is when your child is kind of more tired than usual, a little droopy, we might say. That's normal during an illness. That's how you and I would feel during an illness. I think this can help us touch on another area to look at, which is their hydration. When your child is kind of really run down like that and just kind of blobbing around on the couch, you really want to make sure that you're paying attention to them, how much fluid they're taking in, and also how much urine they're putting out. And as a child gets older, you may only get a rough estimate of that. You're not counting wet diapers, but you can get a sense of it.
And what Sarah was saying, when we feel sick, we want to lie on the couch and we don't want to do much. And kids are often the same way. And parents often get, very uncomfortable when their child's temperature is particularly high and want to know, what's the number? What's the number on the thermometer that makes me have to go to the emergency room? And I always try to tell parents, it's not about the number on the thermometer. It's really about what your kid looks like. And while at 103, everybody's going to look a little pokey. Once you start kind of treating that fever, within 45 minutes or so, you should see some perk up. They may not be at their normal running around the house state, but you should see a little more pep, a little more vigor, and that is very reassuring. It's the kid who, even when the temperature goes down to 101 or something much closer to normal and still looks so pokey, that's the one that kind of raises my blood pressure a little bit.
Got it. So, one of the things that you mentioned is the drinking or wet diapers. What if it's a newborn? Do you consistently feed to give them more liquid? How do you get those liquids into them if they're a newborn baby? I'm assuming breastfeeding bottle, because you don't give them water, or do you?
Well, no, we don't recommend giving water or Pedialyte.
Right.
You would continue as much as you can with your usual schedule, pacing it out. Like
Right,
Dr.
you may have to
Robbins
do
suggested.
more small, frequent feeds as
Right,
opposed to like your normal every 3 to 4 hour feeding,
Yeah.
because the baby's going to fall asleep and be a little, but you'd still be able to wake up, give a good feed, and wet a diaper. Obviously, if the baby's too sleepy, not feeding at all, that kind of brings us back to being a little bit more concerned.
Yeah.
Right,
Yeah.
exactly. And remember, there's water in formula.
Right.
There's water in your breast milk. Breast milk will change during the illness of a child, and it may become a little more watery, a little easier for them to digest, and better at hydrating them. So just trust in your breast milk, trust in the formula.
Yeah. Mm-hmm.
That's amazing.
Oh,
Yes,
amazing.
that's
The
amazing.
human body's amazing.
That's incredible.
Yeah.
So again, the motto, keep them comfortable.
Yeah.
Okay. Tell us about, this is so frightening, the first ever vomit. Oh my God.
I'm a pediatrician.
And we don't
I really
just mean a
like
spit up.
vomit.
We don't just mean a
we're not
spit up.
talking
We're
Right,
spit
we're
up.
not
talking a
talking-
full
yes.
on,
Right.
Right.
like stomach bug vomit type of thing.
Right.
Yes.
So supportive care. Let's move on to that.
Yeah, so usually, if we're talking about getting a stomach virus, the vomiting part is, it feels very aggressive,
Fast and furious.
fast and furious, exactly.
Right? Yeah.
It tends to last a few hours, and then you're usually out of the worst of it. There's not much to do during those few hours where the child is very nauseous, very uncomfortable, vomiting, heaving, that kind of thing.
Right.
You sort of just have to get them through it.
Yeah.
And be patient in this, especially, and now we're not talking about newborns here for sure, but you have to be patient in the sense, like I know you want them to drink and you want them to rehydrate, but that has to be taken slowly, because if you stretch out that little tummy too quickly, all that work and time you took to get that liquid in, it's coming right back at you. So you really got to go slowly, like teaspoons at a time, sip at a straw. I often recommend ice pops because they suck on them and it's a slow way to get in fluid.
So at what point would you say, because again, looking at the difference, we can look at toddlers, newborns.
Right.
Do you get newborns that get stomach bugs? Does that happen? I mean, if a newborn is vomiting, they really probably need to come in and see you, don't
Absolutely.
they?
And we worry about, there's, in pediatrics, different age groups trigger different thoughts in our mind,
Of course.
what we're thinking of when we see certain symptoms. So I think we would probably think about a different list of concerns if we saw it in a newborn, and they should be seen right away, certainly.
Yeah.
Right. I often, with a new baby, I tell parents, spitting up is totally normal, right? And oftentimes when a baby spits up, you look at it, you're like, oh my goodness, it's the
whole
entire,
bottle
it's
feed.
the entire feed.
Right.
And I often say, take a teaspoon, take a burp cloth, take a teaspoon of milk, and just pour it on the birth cloth. It looks like a lot more than it is. You kind of got to get a sense of what's coming back at you. And occasionally, without a good burp, a baby will give back a bigger vomit. One time, if the baby otherwise looks great, okay. If it's repetitively happening, yeah, we need to see that kid on the quick side. And then there's other types of vomit, projectile vomiting,
Right.
straight out of your mouth, almost hitting the opposite wall. That's an automatic, that's an automatic, give us a call, let's talk about this, and have a really low threshold to see that baby in the office.
Yeah. What about, again, with the vomiting, what should we be giving them? Not juice. I'm assuming not juice.
Right. Little sips of water, little sips of Pedialyte. The ice pops, like Robin said. Pedialyte ice pops are probably the best because
The
it's a
best, but
combination
they're
of the
sometimes
two.
not as palatable, so I
They're
just
a little
keep
salty.
Yeah, because you want, when someone's vomiting, you want them to get some salt in. So that's why Pedialyte pops taste salty, because they have a whole rehydration liquid in them. If you can't get a kid to take that, I just keep ice pops in my house just for these circumstances.
Brilliant. Okay. And again, the small frequent feeds and encourage slow drinking, as you mentioned, Robin, okay. What about solids? Should we try and get food into them? Because again, it's that whole feeling of being a parent and you feel like you want to feed them and you want them to be, get that health inside them. What should we be feeding them or not?
You want to wait until some of that liquid stays down. And then once you've seen, significant amount, several ounces, one feeding, what have you, stay down, then you can slowly reintroduce solids. And we say the term is we advance feeding slowly. With an older kid, they can tell you can kind of read them, but they want a cracker, that's fine. You want to start really bland. With a baby, we're really worried more about their hydration. So if they go 24 hours and they don't have solids, that's fine. Nothing's
As long as they're drinking.
Yeah.
Absolutely.
Right, that's fine. Solids at that point anyway are really more about exploration than true nutrition.
Yeah.
So don't stress. As long as they're wetting diapers, they will feed again.
That's good. I love it. Okay.
And we should introduce a term that I'm sure every parent will hear within the first 3 to 5 years of being a parent, the brat diet. That's meant for older kids. That's not meant for infants. But kids who are, older, 2 and up, etc., or 1 and up, the brat diet is essentially bland foods that are very easy to digest. So it's B for banana, R for rice, A for applesauce, T for toast. And that's just a little snippet of some of the very bland foods.
Right.
Yeah, saltines.
Yeah.
Could be brats.
I often say to moms, think of the things you were able to tolerate when you had morning sickness.
Yes.
Saltine, crackers, these are the things your kid is going to be able to tolerate as they're coming off of a stomach bug.
Yeah.
Right.
Yeah. So give us a little rundown of the things to worry about with vomiting. What should the mummies and daddies out there be looking out for?
The hydration is number one. Really, if you're seeing, dry diapers, long, spaces of time between having a wet diaper, if an older kid really yellow, concentrated looking urine, bad belly pain, those are things that kind of warrant, us taking a look at the kid and making sure that there's nothing more they need beyond supportive care at home.
Absolutely.
And obviously normal vomit. You don't want to be seeing any weird colours or anything
you don't want to
like
see
that in it.
Right. There's only sort of 2 weird colors, right? The red blood, frank blood.
However, if they had a red ice pop, keep it in mind.
Yeah, red Tylenol too.
Correct.
Yep.
Right.
And then the other color would be what we would call sort of coffee ground, dark. That's digested blood. But those are rare situations. Just you can file that really far in the back of your mind. We don't see that very often at all in children.
I think one of the things that we should mention to the mums and dads as well is you guys are very unusual that for children that are going through, let's say again going back to the vomiting, you keep some stuff here, don't you, for the mums and dads, for the kids. Is it called
Zofran?
Yes,
Yep.
yes.
Yep.
That's very unusual because I'm going to be swapping to you guys because my kids have had 3 stomach bugs.
Oh, they're
This
the
one
worst.
as well.
It's tough. Yeah.
3 times each.
Yep.
And I had to each time go to my paediatrician and then have to go to a pharmacy. So I
Right.
think it's really important that
Right.
you guys offer us something a little bit different there, don't you?
Right. So we stock this anti-nausea medication in the office so that we can start it here, start it quickly,
And hope to
save you the trip.
rehydrate at home so that we
Yeah.
don't end up with a kid that needs to go in for IV hydration, intravenous hydration in the hospital. But
Right.
that is more geared for older kids.
kids.
Yeah.
Absolutely.
Yeah.
Absolutely.
Yeah. Just thought we'd mention that though.
No, no.
I love that. I love that about you guys. Okay, so the motto, keep them hydrated.
Yes.
Yes.
Excellent.
Yep.
So I think one of the things that you girls just summed it up with, remember you will weather all these unpleasant firsts and
That's
we're
right.
here to help you through
That's
the
true.
storm.
That's right.
That's
I love
true.
that.
Well said.
Listen, Dr. Robin, Dr. Sarah, thank you so much
Thank
for spending
you.
time with us today.
Thanks so much.
Village Pediatrics.